So I always recommend that we want to try to manage situations before they hit a meltdown situation. So once they melt down, right, there's no way you can stop a meltdown.
Hey everyone, welcome back to the Whale Experiment. Today's guest is Dr. Annabelle Chow, founder and principal clinical psychologist of Annabelle Psychology and Annabelle Kids. With an extensive resume of working in hospitals, clinical and community settings in Australia and Singapore, Dr. Annabelle employs a range of therapeutic modalities that are carefully selected for each client, emphasizing her philosophy that the needs of each individual are unique and different. Listen on to make the world a better place. And I'm ready to die. Dr. Annabelle, thank you very much for sharing this space with me today. It is so great to have you here.
Hi, Brian. It's such an honor to be here. Thank you for making me feel so welcome.
Of course. In today's episode, we are diving deep into a topic that affects so many families, communities, and individuals, which is autism spectrum disorder, also abbreviated as ASD. It is generally related to the development of a brain that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. Typically, autism symptoms start to display themselves in early childhood between 12 and 24 months of age, with mental health professionals estimating that 1 in 150 children have ASD in Singapore. Without a doubt, an autism diagnosis can destroy a parent's dreams for the child, and the demands of caregiving can leave parents isolated and exhausted, giving rise more so than ever to the need for support, community, and awareness. Whether you're a parent, caregiver, educator, or simply someone wanting to learn more about ASD, I am sure this episode will deepen your understanding of the condition, which is more crucial than ever for fostering a more inclusive world. Dr. Annabelle, right off the bat, you have accomplished so much in your professional career. What are some of the highlights or experiences that have shaped your work and approach as a psychologist today?
I think primarily for me, I feel quite privileged, like to have my clients trust me and tell me things that are very difficult for them to have shared with people in their ecosystem. And I think that privilege comes with a lot of responsibilities as well, because therapy is not really just a space where you come in and just talk about your troubles. While there's a part of that is about making space to talk about things that would otherwise been hard to talk about. I think it's also about like skills acquisition. That's one. But the other also is to understand yourself a bit deeper, on a deeper level. And it gives me a lot of nourishment to my soul. Like I feel like it gives me meaning in my life. So while it's a privilege that my clients have given me to help them, I think they have given me so much more than what I think I can give them. That keeps me going. That reminds me how everybody is different. And an image that comes to my mind often is, you sit in a train and in a cabin you look opposite and everybody looks as normal as they can be. Everyone's just going to work, going to school, but actually behind that face is filled with different thoughts, different life challenges, different experiences that they would not probably have necessarily shared with somebody else.
Yep.
And I think I'm quite lucky that I have the trust of my clients.
Zooming in, what are some developmental red flags that indicate the presence of ASD in children? When will this appear?
So maybe if I divide them into different categories, and if I think about it like across 4 difficulties, the first one that is often noticed would be more the interaction. So social interaction wise, perhaps the children may not respond when their name is being called, or maybe you find that there's a lack of interaction where perhaps the eye contact is quite limited, or that there's a lack of warmth. Like, you don't have those big smiles, you don't have those big giggles, and they may not be very interested in social interactions. So oftentimes family would start to notice that, because you would expect that little children have big smiles, they are quite interactive, and that's usually one of the big signs. The second one could be communication. So, developmentally, as little children grow, they even if they can't speak yet, they would be able to point and show. So I remembered that actually my firstborn was pretty late with his speech, and with his communication as well. At 18 months, he wasn't actually really able to speak, but he was able to point, and able to communicate with me via like non-verbal signs. So I wasn't too worried because there was that engagement. But you'll find that probably in children with ASD, they would have also like delayed speech. So maybe even by the age of 2, they may not be able to form two-word phrases. And you might find them repeating the same words and phrases over and over again. The third one that is quite commonly noted is probably behaviors. So you would be looking at repetitive behaviors. So sometimes, and the common ones would be like hand flapping or rocking motion, and you find that it's quite repetitive. They just keep doing it again and again. And another really common one that people will start to be aware of is they may be fixated on certain things or certain routines, and actually like being fixated on transport, like for example trains and cars is one common one, but it's not also limited to transport. Lastly, I will be looking at emotion dysregulation. So they may have some difficulties responding appropriately to people's facial expression. They may not be able to actually express their emotions. And most importantly, they are very hard to soothe when they are distressed. So this thing about the emotion regulation part, right? Sometimes parents may mistake these signs as the children having a shy temperament. But if you start to notice all these symptoms together, then I would definitely recommend getting the child assessed by a psychologist.
From my understanding, there is a standardized assessment tool called the Autism Diagnostic Observation Schedule, ADOS 2, to aid a psychologist like yourself in diagnosing ASD in children and adults. Could you elaborate more on the process?
Yeah. So the ADOS is actually a standardized semi-structured interaction-based assessment. So it has different modules that cater for different language abilities. So the psychologist will actually engage the child in different activities to assess his or her ability to be able to execute specific skills in terms of like these domains that we just talked about, like communication, social interaction, whether they are able to engage in play or not. And then it helps to determine whether they fulfill the criteria, and if they do, how severe is the presentation. The ADOS is actually usually paired with the ADIR. So it's the Autism Diagnostic Interview. So we call it the ADIR. So that's a comprehensive interview that we usually conduct with the primary caregiver, most of the times the parents, because this ADIR allows us to put together a detailed developmental history. So these two assessments put together can actually help to inform the way that we plan interventions for the child.
While there is no cure for ASD, I believe intensive and early treatment can most definitely make a big difference in the lives of many children and aid them in improving their areas of weaknesses. What are some options that a caregiver can look into? And how do we determine which will work best?
Mm. I think the first thing I would do before I even look at the options is actually, I think the early intervention is really, really critical when it comes to helping children with ASD. We can help them pick up the skills as early as possible. But in our experience, to be able to do that, I think it's very difficult for parents first to come to terms that maybe my child needs intervention and my child may have a diagnosis. So I think when it comes to helping our children with ASD, the first thing is early intervention is really quite critical, because with an early diagnosis, we can actually intervene early, and research has consistently shown the positive effects of that. However, I think for early intervention to happen, it can sometimes be quite difficult for parents to come to terms that my child may need a diagnosis, and that, firstly, I need to bring my child to be assessed and potentially have diagnosis. And depending on the environment that we find ourselves in, it may be related to different types of stigma. So sometimes that affects the intervention from the family's side. Um, we've also had experiences where it's difficult for parents, understandably, to accept the diagnosis. And I think a lot of education and a lot of support can be given to family members. So once we cross those hurdles, then we can look into the different options. So depending on how the child comes up on the ADOS and the ADIR, the different types of interventions will differ. So, for example, if we assess that we need to help the child with speech first, as you can imagine, if the child has difficulties speaking and communicating in the first place, they will likely get quite distressed because nobody understands them. Then they will likely have difficulties learning, identifying, and managing their emotions. So even when our children don't have ASD, learning how to manage big emotions is already a very big thing. And if you can't communicate that, it would be significantly harder. So we might want to start from the depending on the developmental milestones, we might look at the speech. So in our multidisciplinary team, at Annabelle Kids, we actually run a multidisciplinary assessment. So we get different disciplines like the speech therapist, we get the occupational therapists, and we get the psychologist together, and we all interview and observe the child together because we want to help the family save time as well, and you get a bit more holistic perspective. So it's either speech first, or sometimes it can be occupational therapy first, because there'll be certain skills again that are required for our independence, right? Like, for example, fine and gross motor skills to pick up things, our hand-eye coordination, any kind of sensory integration, or even social participation. So again, if these elements are not in place, it can cause a lot of distress. And if you have difficulties communicating, then you will have more distress. And then thirdly, I think I was talking about early intervention. So we have early intervention programs, otherwise known as EPIC. So these are small little group settings where it's like social skills group, where it supports early key developments like communication, social interaction, helping our child get into routine, learning how to interact with other little kids. So those early intervention programs tend to be a complementary and quite necessary intervention for our children with ASD. Of course, there are other different types of therapies, like, a commonly heard one is applied behavior therapy, ABA, where it reinforces positive behaviors and discourages negative behaviors. And it focuses a lot on not only building skills, but also reducing those self-injurious behavior. So I think in terms of what would probably be better for them, I think it's quite important to first make sure that your child is looked after by a multidisciplinary team. And that's probably not enough. Your multidisciplinary team must talk to each other because you actually need your treatment team to be quite tight. If the information, and sometimes the parents will tell us this, right? They get quite frustrated if they go to different centers and they seek help from different therapists, and the therapists may not have the time or the consent to speak with each other. And then you also have to speak to the family, and you also have to speak to the school. So I think the cross flow of information is really quite pertinent. And the other thing is the child's progress needs to be monitored to determine if the approach needs to change over time as well. But most importantly, right, the goal is really not to fix them. I think that's a very common request that comes
Yeah.
in. Just fix the problem, fix my child. But instead of that, actually, we are trying to honor the child for who he or she is, and everybody is different. And we are trying to equip them with the right tools to help them thrive in this environment. Sometimes I also remind clients what's not to say that they are the ones who are air quote normal, and then we are the ones who are not, right? But it
Yep.
just happens that in this world we might understand each other a little bit better, and they live in a different world where they might interpret, or they might be overstimulated, and they might have different experiences and they find it difficult to communicate, but doesn't mean that they are wrong, right? It just means it's different. And I think our environment can be more open to accommodate different types of presentations and difficulties.
Dr. Annabelle, as you were just speaking, I just got reminded all over again why all these different modalities are set and introduced in place. And over the last few decades, many people have become more aware of the condition and the thrilling realities of raising a child with autism. But there are still many misconceptions and ideas about what autism is and what it isn't. Could you run us through a few?
So I think the first thing I will say is autism can be cured. So that it's a number one myth that is quite common. I suppose what I will say to that is autism is a neurodevelopmental condition, and it's not really a condition that it can be cured per se. So there's no cure, but early intervention is helpful. I think early education and also support to the family members to come to terms and learn how to be equipped to communicate and behave is very necessary. So we are not fixing them. So that's probably a very big myth that that people have with autism. The second one is people with autism don't have feelings or they cannot show affection. That's really not true. It's just that they express their emotions differently. So it may be just not what we might typically expect, but there is nothing like they can still feel, they can still understand, and they can still accept the feeling of affection, but maybe it's just expressed in a different way. Another very common one is individuals with autism have intellectual disabilities. They're actually two separate conditions and they may or may not coexist. So, in fact, actually, many with ASD, they may have average or even above average intelligence. So, there are separate diagnoses that require separate interventions. So, they are not the same. So, maybe the other one that comes to mind may be that, people with autism, they may not be successful. They cannot be successful or independent. I think that one is also not true. So with the right support, with early intervention, they can also have very meaningful careers to them, right? So, and they can also be quite independent in kind of having their own life and being financially independent as well. They just also need to find the correct support and ecosystem.
I know that defiance in children with ASD, be it sensory sensitivities or meltdowns, can be a frustrating experience for both parents and caregivers. What are some effective strategies to help these children better express themselves and navigate challenging situations?
My first response to that, right, is also a crucial and critical reminder I hold to myself as a parent. I think we have quite unrealistic expectations of our children to better express themselves, not throw tantrum, be well behaved, sit still, don't shout, don't scream, don't climb all over. And actually, developmentally, even if our child don't have ASD, it's not actually a realistic expectation. So one major reminder I have as a parent is really number one, what are my expectations? Are they realistic or not? And number two, if I want, I mean, firstly, if my expectations are not realistic, right, I think that will shift our mindset already, that when our children have tantrums, we don't think that they are trying to be difficult, or it's a massive meltdown, but we might actually be able to approach it with significantly more compassion
Yep.
and understanding, and that actually helps us to regulate how we feel. And for our children to regulate themselves, we need to first actually regulate ourselves. because if we are also reacting to the situation, then they will also react to us. And then it just, there's actually a book that says it just becomes a jungle. That was a catchphrase that I caught on, right? Everyone's just responding to each other in very unhealthy ways. So I think it's very easy to tell ourselves to stay calm, but actually, while it is true that a calm demeanor can help our children feel more secure, ASD or not, I think the first thing is maybe starting from the way we think about it. So I think it's really to reframe our expectations and to acknowledge our child's developmental limitations, or that with ASD, there are certain limitations, that there are certain skills that they haven't learned. And so it would be difficult for them to execute. And when they are frustrated, they also don't know how to express their frustrated in a healthy way. Then if we take that framework, then I think it's likely that it's easier that we can regulate how we feel, to change the way we respond. But if we can't, we need to tap out and get another caregiver to step in while we try to go and do some self-care or stress management to regulate how we feel. And using our five senses can be helpful. So, for example, like taking a shower, going for a brisk walk, going for a run, screaming into the pillow. I recently have a new thing, which is a music punching box. And you kind of punch it and then it lights up. So that's quite gratifying. Or taking a bath, we have to figure out different ways that work for us. And it can also be a really helpful modeling for our kids. Another one that I find really helpful for kids is the use of hand gum, because it's very sensory and they can kind of pull. So it's a little bit like plasticine. So that can be also really helpful. Um, Secondly, I would suggest like consistency is quite crucial. So our children will actually understand what kind of behaviors are expected, and it provides stability and predictability. So it helps them also anticipate. So even though you might expect some difficulty before they get to the point that they are able to respond appropriately, I think it's really a rinse and repeat situation to stay consistent. I think sometimes using visual aids can be really helpful to show certain routines and simple instructions like sit down or change your clothes. So I always recommend that we want to try to manage situations before they hit a meltdown situation. So once they melt down, right, there's no way you can stop a meltdown. So if you think about adults, when we are really full on tantruming, right, as an adult, whether it's to our partners or, we are glitching already, we can't stop. Even as adults, when we tell ourselves we should stop. And little children have even lesser capacity to stop. So I think when we are glitching, we can't actually stop a tantrum. So we want to try to do these things like consistency, like visual aids, so that we can predict like certain parts where maybe they require more time, that they get more frustrated. We try to anticipate that, and then we try to do something to fit in to de-escalate or avoid a tantrum, so that can also help to regulate. I think the other one that I want to say is also, I think we sometimes forget to give our children some autonomy and sense of control. And you can imagine that it's quite easy to forget to give our children with ASD choices, because a lot of times, understandably so, it's already very stressful for parents, having to work and also manage the household and manage our children. And when our children have big feelings that they can't communicate effectively, it is actually quite frustrating, and we just want to kind of go and just move on, right? And that can also be very frustrating for the child. So I think offering some limited options, like for example, which shirt you want to wear, left or right. So there are two options, right? Or do you want to eat rice or noodles? So this gives the child some sense of autonomy and control that can also significantly help them reduce their feeling of frustration and being overwhelmed.
While the exact cause of autism is still not fully understood, in your opinion, are there certain factors that are believed to increase the risk?
Autism is a complex condition. The current research suggests that it's a combination of factors like genetic links, like genetic factors like Rett syndrome, Fragile X syndrome, genes that affect brain development or the way brain cells communicate with each other, some environmental factors, or even like advanced parental age or infections during pregnancy, premature births, or any kind of brain development before or right after birth. So I I think this is what the current research shows, but it's still evolving, and I think we are still trying our best to understand. And I'm confident that there will be more research that will be born in the coming years. What I will probably highlight is there's a popular myth that vaccines contribute to the development of ASD in children. But actually, up to this point, there's no reliable study that actually shows any causal link between the two. So I think that's quite important information to share.
One of the biggest challenges is the possibility of social isolation for persons with autism and their families because behaviors that arise from autism are not always well understood by members of the public. This in turn discourages persons with autism and their caregivers from accessing public spaces and facilities. What's your take on it?
My take on this is actually it's not just autism. It's anything, right? Anything that the general society or public doesn't consider to be the norm, then it will invite judgments, or it will invite conversations, and as a result of that, sometimes people who don't fall neatly into the bell curve of what is considered normal can feel quite socially isolated because there might be distance that is put between them. So specific to ASD, I will remind people that number one, as long as people don't understand something well enough, they don't feel equipped to handle it. So it's like uncertain. Usually one of the primitive coping strategy is we might choose to avoid because it's fight or flight. But it has actually really nothing got to do with the family who has to look after a child with ASD, or actually is the child. Actually, this is more reflective of the person who has very limited knowledge, don't really know what to do, what to expect, don't know how to handle. And one of the primitive automatic responses is actually to avoid because uncertainty breeds discomfort. And the second thing I like to remind is also that everybody shares the society, and the society is colorful and interesting because it's made up of different types of people with different physical, mental, neurodevelopmental conditions, and that's what makes life interesting. And the society and the environment is very much for people who don't have these conditions, these including physical and mental, or including, and autism should not be excluded from it. Um, the other thing that I always remind them as well is we just cognitively, we are quite judgmental people. We judge everything from the weather to the coffee to how people dress, much less say when somebody presents with behaviors that are probably out of the norm, and we don't really understand it, right? And so naturally everyone is very judgmental, but we probably and also if we understand that it's a way for us to make very quick decisions, again for survival, because it's a heuristic. It's the way that our brain learns to make quick decisions to help us survive. With the little bit of information and a little bit of time, we just want to keep ourselves safe. So evolutionarily, that's why we are all like so quick to judge and quick to make decisions, and sometimes quite reactive, non-helpful, non-wise decisions. And I will remind family members that probably we need to learn on one hand to accept that, But another is we don't probably want to shortchange our own children from being part of this community and this society just because person A, B, or C might have a negative response or an unkind response to our child. But perhaps as a family member, I need to learn how to draw appropriate boundaries, how to communicate effectively, how to keep my child safe, how to equip my child with skills to manage these situations, so that my child can continue to be part of this world that is already very stimulating and very scary for them, but to help them navigate as well and to help them manage the challenges that will occur. And the reminder there is everybody will have different set of challenges, and it could also be someone, for example, who is dressed weirdly, right? Everybody will also have judgment of that, and that person also needs to pick up these skills. So don't shortchange our kids for fear of judgment of others, but maybe redirect our focus on what's more helpful for our child.
Thank you very much for sharing that. That was very well said. From where you stand, is there a particular quote or saying that you feel best captures the hope and optimism you have for children and families living with ASD?
I think there's so many quotes that it's so difficult for me to really pick one quote. But if it's my own quote, I would say that this environment, the world is made up for everybody. And the everybody doesn't only include race and ethnicity, and it also includes neurodiverse conditions. And I think that's what makes the world colorful. And perhaps we should start learning their world, right? We have a lot of expectations to ask them to learn about our world, but I think it's also time that we start to walk into their world and learn about their world. And who's to say that their world is not more colorful and beautiful than ours?
Dr. Annabelle, as we come to a close, could you briefly sum up why working with a multidisciplinary team like yours will ensure a comprehensive approach to a child's development in mitigating ASD? And where can people reach out to you should the need arise?
Okay, so one of the things that I was talking about is how consistency is really important for the child. So consistency is not really just in session, right? Consistency needs to be consistent across the family environment, the school environment, as well as the treatment team. So in our multidisciplinary team that comprises of our speech therapists, occupational therapists, we also have an art therapist, and we also have a psychologist. All these different therapists communicate with each other intimately so that the child is always on the same page of the treatment care, of course with parents' consent. And we also would help to communicate not only to family but also to the school and the school teachers and counselors to help them navigate and maintain consistency. So I think this is really quite important. Probably another thing that I'm quite proud of my team is a multidisciplinary intake. So I think a feedback that we've gotten from parents with ASD, children with ASD, is that they find themselves running around different centers across Singapore to see different therapists. And sometimes different therapists got different training, different experience, and then they may all say different things. So it can get really confusing. But our multidisciplinary intake actually helps to save time and even helps to save money by having the child actually watch in a holistic, natural environment of play. And then all the different therapies actually see and observe and give give the parent a report and an explanation of what we think could be best for the child. So we are Annabelle Kids. We believe in play therapy. We believe in every child having the opportunity to thrive, and they just need to be equipped with the correct skills. So we can be found at apsy.sg or akids.sg, akids.sg. We are located centrally in Novena and Thomson Road. And you can find us on our Instagram handles as well. We try to put up interactive and helpful information for family and friends. And you can find us on Annabelle Psychology or Annabelle Kids Instagram handles.
Dr. Annabelle, thank you so much once again for your time today.
Thank you, Brian, for having me. It has been a pleasure.
We've been speaking to Dr. Annabelle Chow, founder and principal clinical psychologist of Annabelle Psychology and Annabelle Kids.